It's interesting, we do a lot of redo procedures after other patients have had facelifts or eyelid surgery or noses elsewhere and are particularly good at revisions. I prefer strongly to do things right the first time, but we can also fix other work. But what's surprising to me is the Texas State Board of Medical Examiners and all legal precedents say a surgeon should explain to the patient what the risks and complications are they may encounter. Yet I have encountered patients who've had multiple surgeries at other places. The surgeon never said word one about things that can go wrong. And interestingly, the Texas State Board said specifically, and legal precedent has said, a surgeon cannot delegate that to another caregiver. So here I am, I wanted to go over for specifically a face and neck lift, what complications can occur. Our risk of these in our practice is extraordinarily low, but I still want you to be informed. Number one, there can be a risk of a hematoma or bleeding under the cheek or neck skin requiring a return trip to surgery. That risk is about 1 in 200 patients. There is a risk of permanent nerve injury affecting the ability of the face to move. That risk has been reported in literature, depending on technique, at about 1%. And by this we mean a permanent injury that never recovers. We have never had a permanent injury. We have up to 10% of our patients have some temporary weakness of the grimace muscle in the face. This has resolved in all cases. Many of my patients say, why would I care about that? Why do I need to grimace? You don't need to grimace, but it can make your smile asymmetric. But again, that has been reported by other national groups doing deep plane lifts at the same statistics as us. And like us, they have found it always resolves. There is a risk of skin loss at the edges of the flap, specifically in front of the ear or behind the ear. The nice thing is that this normally heals on its own without any further procedures. This risk is obviously higher if there's an active smoker or someone who has had energy treatments such as Body Tight, Renuvion to the skin and facial flaps, ruining some of the blood supply to the skin. But again, that risk is very low. If we are doing some of the deeper neck work, there can be a risk of fluid collections or seromas around the glands. That can occur. Again, it's rare and easily managed. We do a fair amount of cases where we remove the accessory salivary glands below the neck to give a better contour. There is a theoretic risk of mouth dryness after that. We have not seen a case of that in our experience of over 100 cases, and similarly, national groups have reported the same. There can be fluid collections around the removed gland that require aspiration in the office. We have had, nor has any other major surgical group had any permanent fluid collections. There can be visible scars despite our best attempt to hide them. It's not something we see virtually ever, but it can occur. And the biggest thing to be aware of is there can be swelling in some individuals that lasts longer than others, requiring more patience.